morning, doctor. I'm happy to visit Kalari Rasayana today. I would like to ask you some questions regarding the treatment that you offer here. For which kind of diseases you mostly would like to see the patients?
Yeah, so once again, welcome to our Kalari Rasayana, Kalari Rasayana Ayurveda Hospital. So here generally we get patients like very common is arthritis problem. So it may be osteoarthritis, maybe a gout arthritis, maybe rheumatoid arthritis. These are nowadays very common is arthritis issues. And other common diseases like digestive disorders, lifestyle disorders, and of course stress. Because the whole world is behind a lot of stress. So because of this stress, people are having different issues like memory problems, loss of concentration, and like mind-related problems, all are related with stress because people are unable to deal with the stress. So if you are unable to deal with the stress, automatically it will turn into a different conditions. So such you can say like you cannot say it's a mental disorder, but it's like related to the mind, loss of concentration, loss of interest in the jobs. So that kind of diseases. Another category of like lifestyle disorders, it is very common lifestyle disorders because examples, diabetes, one of the main kind of lifestyle disorders, like heart diseases. We have a lot of patients of diabetes cases. The heart diseases in the sense means like not the acute condition, acute or chronic condition. We used to get obese cases. Then skin disease. Very many cases we used to get skin disease, and I am especially a specialist in skin disease. Like my post graduation, my MD is in the skin diseases. So skin disease we used to get. So another like neuromuscular disorders, spinal disorders. So almost all areas we used to get, and not the cancer cases, but post chemo like
Post cancer rehabilitation.
Yeah, rehabilitation. These are some of the diseases we used to get, like migraines, headaches, memory problems. So these are those.
And what kind of results we can expect, for example, for obesity treatment?
Obesity treatment, as far as like not only the treatments, even with treatments there is importance for the diet also. We will go with a very strict diet here, depending on the condition, depending on the status of the patient. We have 2 programs, 14 days program and 21 days program, and sometimes 4 weeks also. So in 14 days program, I have seen some reduction of 7-8 kilograms. Generally, minimum 4 or 5 kgs I used to get, but that is, we cannot say that it is like
it depends on each person.
Depends on the person, depends on his activities, his or her activity. Because we can advise them, we can make them to do, but how they follow, that is also makes like I can give the treatments, I can give the medicines, the rest of the things. Sometimes I'll ask them to do some activities, but they have to follow it mindfully. So I used to push the person, but sometimes without doing mindfully, sometimes that won't work properly. But here I'm a little bit strict because anyway you came for the treatment plan, so you go up with best results. So like 7-8 kgs I used to get, and sometimes in 21-28 days 15 happened, many times it's happened. They're happy.
And do they continue some tablets or some kind of recommendation when they come back home?
Going back home, we give some discharge medicines, not for the long time, maybe 1 month, 2 months if it is necessary, but strictly we'll give a special diet. So what kind of diet they have to plan. So in future, like not for the next 3 months or 6 months. Next,
Life.
lifetime, how they can prevent the diseases, how they can follow a proper lifestyle. Totally going with the principles of the Ayurveda. So we give a detailed diet list.
And regarding the psoriasis treatment, how many days it is required, and how many days or months remission we can reach after the
We
treatment?
used to get a very good result within 2 weeks or 3 weeks. Minimum within 2 weeks we can find a very good result. But the follow-up they have to do proper diet. But it is a chronic case, like more than 2 years, 3 years minimum. They have to do 3 weeks or 4 weeks.
So in the next 2-3 years, they need to come back for the treatment for 2 weeks.
Yeah, that depending upon their how their body is responding with the treatment. Sometimes within one sitting we may get very good results. Sometimes repeatedly first 2-3 years we have to do. Totally depending upon the type of disease, because psoriasis and many number of psoriasis are there. Like sometimes psoriasis is a dry type, sometimes wet type, sometimes a combined one. It is many types of psoriasis are there.
Let's say if the person come for 2 weeks treatment and he go back home, and how long he is relieved from the skin problems?
Usually I have seen if they are following proper treatment here 14 days, and within 3-4 months they can see very best results.
And if they follow your recommendation and come for second and the third year, how long they can be relieved?
Yes, we can they totally means no need within second visit or third visit. Totally we can cure the disease, of course. But if it is allergic, if you are again exposing to that things, I cannot assure that.
Okay, and there are a lot of patients who are suffering from vertebral hernias. Is it possible to treat them in Ayurveda centers?
Of course. So vertebral hernias means the treatments principally. I'm not saying that after Ayurveda treatment the hernia may not go totally. The herniation may be there because it's a long standing. Herniation means in between the two vertebrae there is a disc is there. So when the pressure comes, means the disc bulges. So that herniation is coming. So we are not going to bring that. We cannot bring back the disc into normal because it's already herniation come. The next thing means further aggravation should not come, and because of the herniation, you should not get any other issues. Because of this herniation, neighboring maybe this hernia may disturb the neighboring nerves, maybe disturb the neighboring vessels. Whenever it is irritating the nerves, means the pain radiates to your maybe legs, maybe hands, and proper circulation won't happen. So to avoid that, we give some special treatment. Means the structure, where the herniation happened, surrounding structures, we have to give more strength. We have to give more strength to the surrounding muscles, surrounding vessels, and we have to avoid the further aggravation. Further aggravation. So the person may be having that herniation, but he may not be feeling like that herniation is disturbing you. So there 80% result, not the 100%. 100% means the hernia has to may not go, but because of that hernia you won't feel any difficulty.
Regarding diabetes, is it possible to help this patient in which way? Which result can expect to the diabetic patients for the treatment?
Diabetes cases we can reverse the diabetes. Sometimes with medication, some without with diet. There also we have to think about the onset. If patient is having some 20 years history, 15 years history, 10 years history, it's long standing because long history of insulin. There are also a lot of difficulties there. So here I have seen we can reverse the diabetes cases, and sometimes like long-standing insulin dependent, we can avoid the insulin, but they have to continue the medicine tablets. But we can reduce or we can avoid the insulin. In that stage, we can make the person into that stage.
So
And within 5 years case, almost we can make them to go with only Ayurveda herbs, Ayurveda tablets or Ayurveda diet.
And you have seen such results in your practice?
Yes.
Okay. Thank you very much for this talk. It was very interesting.
Thank you.
Thank you very much for helping the patients.
Thank you.